Live to find out. Let's
Oh.
see. Hey, everybody. Welcome to another live stream here. Today we have Pam Gayton from Tercera. How are you?
Hi, I'm great. Happy Saturday.
So Pam Getton is an RN, BSN, and an expert in neuroendocrine tumors. She started out at the Rocky Mountain Cancer Center on Dr. Lou's team, and she continues to be part of the NET community. And now she's with Tessera. Here she is today to talk about diet and nutrition. Thank you, Pam, for being here. We always appreciate you taking time out of your weekend to spend time with us. So we're hoping that you'll give us some good information.
Absolutely. Thank you for inviting me to join. So I just want to say hello to everyone. I know a lot of patients within the NET community. As Marianne said, I actually started within the NET community in 2017. I actually was Dr. Eric Liu's nurse for about 3 years at the Rocky Mountain Cancer Center in Denver, at which time I was doing some work for some different pharmaceutical companies, speaking about neuroendocrine tumors and treatments. And at that time, the makers of Zermello sought me out to see if I would be interested in coming on board to put together a team of clinical nurse educators and educate patients as well as clinics on neuroendocrine tumors. So at that time in 2017, I left Dr. Liu, who was very, very supportive, and basically said, if you don't leave and go do this, I will fire you because you are worth so much out there speaking and helping the patients. So here I am today. I'm currently an executive director of clinical nurse educators and patient advocacy with Tercera Therapeutics. We actually have a nurse support program, which I'll talk more about. So anybody who has carcinoid syndrome, whether they're on Zermello or not, are more than welcome to join our nurse support program. We currently have over 500 neuroendocrine patients in our nurse support program that we speak to on a regular basis. And I'm sure many of you hopefully are part of that nurse support program and have had the opportunity to speak to some of my amazing nurses. So with that being said, I'm here to present to you guys information on eating when you have neuroendocrine tumors and carcinoid syndrome. With that, hold on, I just need to, there we go, advance my slide. So Tercera's commitment. So Tercera is committed to advancing treatment for GI NETs and carcinoid syndrome. Tercera created this presentation and the Find Food You Love nutrition guide to help people living with neuroendocrine tumors and carcinoid syndrome re-energize their love of food and make healthy choices. So I'm happy to bring this presentation to you all today. This, remember, is for educational purposes only. It's not meant to replace or advise as part of your healthcare team. It's always important to talk to your doctor about your diarrhea, nutrition, and ask about medications that can help treat the cause of your diarrhea or your diarrhea symptoms. So notable history and honors. This presentation was built as well as the Find Food You Love nutrition guide around the papers written by Monica Warner. She was a nutritionist. She was the first patient advocate to focus her attention on NETs and carcinoid syndrome specific nutrition issues. For more information on Monica Warner and her papers and presentations, you can go to carcinoid.org. So today's topic, we're going to talk about the digestion process, understanding, identifying types of diarrhea. What I can say is they call us the diarrhea queens. I can also tell you that I have two daughters that would always say, Mom, let's not analyze anybody's poop this evening. And also they would never really want to tell me if they had a stomach issue because we would have to talk in great detail about their diarrhea. We'll talk about common triggers, staple foods, and then we'll talk through some recipes. These recipes myself, I have tried. Some of them are not great. Others, it's a great idea when you talk about adding applesauce instead of certain sugars, or if you look at using like a protein yogurt rather than a fat sauce on some pizzas. So let's talk about the digestive process. So our digestion plays a really important role in our nutrition. Your diet impacts how foods move through your body, the frequency of our bowel movements, absorption, certain components of food, and how we eat them interact with our GI tract, which means basically they can worsen our diarrhea or they can slow down the rate of movement through our digestive system. So normal digestion, highly controlled process, takes into account several factors, including the hormones, and the organs that make up the GI tract help the body digest food and absorb the nutrients it needs. So what we find is our NET patients with GI NETs and carcinoid syndrome digestion, foods tend to move through the gut at a much faster rate because of the excess serotonin that is released from these neuroendocrine tumors. So you can have also treatment side effects from SSA, which tends to slow down the GI movement and some of the hormones. And then you have surgeries that can alter your GI tract and how your body absorbs. So it's what we find is that a lot of our NET patients have difficulty absorbing the needed nutrients as well. So we're going to talk through some ideas and some ways to help with that. Supporting your nutrition needs. So it's important that you understand your nutrition needs. It's important that you learn about the different types of diarrhea that can occur with GI NETs and carcinoid syndrome. It's important to identify which type of diarrhea you're experiencing so you can make healthy choices and changes with your healthcare provider. So basically, I want you all to feel very confident asking questions about your diarrhea. If you do have diarrhea, feeling very comfortable talking to your healthcare provider because it helps them lead you in better treatment options. So let's talk a bit about diarrhea. So there are 4 different types of diarrhea I'm going to talk about today: steatorrhea, secretory, rapid transit time, and bile acid. So steatorrhea. So medications like the SSA, which is lanreotide and octreotide, as well as surgical procedures can reduce the production of your pancreatic enzymes. So your SSA can slow down the hormones that your pancreas produces. And so you're not producing enough enzymes to properly digest and break down the fats. So what we ask patients is, talk to me. Are your stools floating in the toilet? Do they have a foul smell? Do you have some gas, abdomen bloating? These are bowel movements that will be pale in color and can leave a ring around the toilet. So what we say, especially these bowel movements that are floaty, are really patients need to avoid foods that are high in fats. Secretory. So why this occurs are these GI nuts release several peptides and hormones like serotonin. So this overproduction of serotonin in the gut contributes to your symptoms of carcinoid syndrome. These are watery stools, urgent diarrhea that literally at times patients will feel just like running down their leg. These are bowel movements that wake up patients in the middle of the night, even if you didn't eat anything before you went to sleep. So what we always suggest for these patients, eat small, frequent meals, even, 8 to 10 times a day, just small amounts of food. Eat plenty of protein. Eat foods that are low in amines, such as tyramine and histamines, and stay hydrated. So we will talk a little bit about the foods low in amines as well. Then we have rapid transit time diarrhea. So these are for our patients who have had small bowel resection surgeries. So having a bowel movement almost immediately after eating. These are patients within 30 minutes of eating that will have a bowel movement. Experiencing weakness, hunger, or even a faster heart rate 2 to 3 minutes after eating. So what we suggest to these patients is to choose a soluble fiber instead of insoluble fiber, and we're going to discuss that here shortly. Spend time to really chew your food. So really think about chewing your food, to break it down in your mouth so it doesn't move through, so your body's able to absorb the nutrients as it moves through your digestive process. Avoid those concentrated sweets and limit fluids with meal. So what I always say is, if you're eating and you're drinking, don't do it at the same time. Eat, chew it up really well. Sometimes even separate. Just take sips of drinks rather than taking large amounts of fluids in while you eat. Bile acid diarrhea. What causes this is surgeries of the upper GI tract. A lot of our patients have their gallbladders removed. So the SSA, octreotide and lanreotide, sometimes we'll call sludge in the gallbladder. So a lot of patients tend to have their gallbladders removed whenever they have a GI surgery. And so what happens is a large amount of bile acids get into the colon. This can be, burning diarrhea, urgent, frequent trips to the bathroom. So what we say for these patients is to avoid those greasy and high-fat foods that cause that burning diarrhea. Let's talk about triggers. Common trigger symptoms. So it's really important to get to know the foods and eating habits that have been known to trigger symptoms. Carbonated drinks, concentrated sweets, high fructose, corn syrup, candies, alcohol. Alcohol is a common trigger for many patients. High fat foods, those French fries, those fried foods. Amines, foods high like histamine and tyramine. So these are your cheeses, your meats, like different pepperonis and sausages and foods as such. You should avoid large meals. Instead of having a large meal, eat several small meals throughout the day. Caffeinated drinks or coffees, sodas are common triggers, as well as spicy foods. Try to stay away from, spicy foods, especially those hot Cheetos. No, I'm just kidding on that, but you should stay away from those. Those are some of the common triggers. Let's talk about some staple foods for people with GI NETs and carcinoid syndrome. Soluble fiber. So let's talk about soluble fiber versus insoluble fiber. So soluble fiber, it slows the digestion. So this allows your body to absorb those carbohydrates and other nutrients. So I suggest our patients that have carcinoid syndrome diarrhea to really focus on eating more soluble fiber rather than insoluble fiber. So these are fruits that we peel the skins, small amounts of nut butter, cooking your vegetables rather than eating raw vegetables, peeling your stems and removing the seeds, and instead of eating the brown rice and the brown breads, eating white rice and white breads. This will help to slow down the rate that foods are moving through your digestive tract. Insoluble fiber. So these are your wheat brands, your whole grains. These are your foods that have skin on your fruits, skin on your vegetables. Soluble fiber is what we recommend, not your insoluble fibers. Because what happens is when you eat like a piece of whole wheat bread, it moves through the GI tract mostly intact. It's moving through quickly. It moves too quickly for your body to absorb. So if you have neuroendocrine tumors that are producing more serotonin, so you have the excess serotonin plus the bran moving through your digestive tract, it's moving through very quickly, which can increase your diarrhea. We were all taught as we were growing up to eat more insoluble fiber, but I always suggest to my NET patients with carcinoid syndrome diarrhea, focus more on your white rices, your white breads. Make sure you're peeling your vegetables and fruits and cooking your vegetables rather than eating them raw. High protein meals. High protein meals are important for everybody. Protein takes longer to break down within our body. Protein is used to repair the tissue within our body. It helps to support a healthy immune system. So people with GI NETs and carcinoid syndrome should eat more lean protein. So chickens, skinless chicken, different fish, eggs are fine to eat. Remember though, the yolk of an egg is high in cholesterol. So sometimes if you're eating a omelet, I suggest using the egg whites and maybe only one of the yolk of an egg because of the cholesterol in it. Eat low-fat beefs, which are leaner protein, with less fat and marbling through the beef. And pork, of course, is what they consider the other white meat, which is good for patients. Additional suggestions. I know I've spoke about it a couple of times today. Eat small, frequent meals. A lot of those large meals may aggravate diarrhea symptoms. So 4 to 6 small high protein meals or snacks per day. Some of my patients, I suggest even a high protein yogurt. Depending on medications people take, sometimes I suggest even a cracker with just a little bit of nut butter on it to have a high protein with a little bit of fat. Some medications, remember, are better absorbed when you are eating a fat with it. Separate food and drink. Leave 30 minutes between your eating and your drinking. This way, foods move through your digestive tract slower. And as you're eating, be conscious of really chewing your food. Avoid those concentrated sugars. Foods high in sugar pull water into the GI tract, leading your body to lose excess fluids and nutrients. Stay away from those concentrated sugars. And then try foods that really have less than 12 grams of sugar per serving. And with that, I just wanted to kind of point out some different recipes with you all. Roasted vegetable white pizza. Here we have self-rising flour that we use. It's a white flour, non-fat Greek yogurt, higher in protein. And then the dietitian on this recipe took the zucchini, the summer squash, and the bell peppers, and they peeled them and finely chopped them. So when they were put on the pizza, they were cooked as well. And then using like a non-fat ricotta cheese rather than a higher fat cheese. So with that, I also wanted to point out that you all are able to order this book. It's free of charge. It's called Find Food You Love. It's a practical guide to nutrition, providing useful insight into GI nuts, carcinoid syndrome, and nutrition. Talks about the digestive process. It talks about food and eating habits. It also has different staple ingredients that you can use to make your favorite meals. It has many different recipes from around the globe as well. So if you're interested in ordering this, you can go to foodyoulovebook.com, complete the form, and one of our clinical nurse educators will send this out to you within the next week or two via Federal Express. That is what I have to present to you guys today. The other thing that I did want to mention to you all is that we do have a nurse support program. If you are interested in speaking to a neuroendocrine nurse, such as myself or one of the nurses on my team, you can go to enrollzermello.com, sign up, and a nurse will contact you within 48 business hours. It just gives you a neuroendocrine trained nurse that you can, call for any of these nutrition recommendations. Remember, we can't give medical advice, but we can definitely provide you some recommendations. So with that, I'm going to turn it back over to Mike and Marianne to see if we have any questions.
Yes.
Well, thank you, Pam. That was great.
So yeah, I do have a few questions here. First question, is there a relationship between nutrition and survival in nets?
I believe there is. I believe it's very important for you to be aware of your nutrition, both for maintaining and having a stable weight, right? Especially if we have patients who have had surgery and you have a fast GI tract. We need to make sure that your body is absorbing the right nutrients. So I think nutrition is extremely important. And we have nurses available to work with you to really track what you eat, even for 7 days, so we can help you identify what your triggers are. I believe, truthfully, for everybody's health and nutrition is extremely important. I know myself, within the last year or so, I personally have started to try to eat much better. With that being said, I've taken off weight. I have more energy. I feel healthier. And I believe that many of you on the phone would agree that if you eat healthier, you feel better. So I think overall survival for all of us has to do with making good nutrition choices.
Yep. Is it normal to experience all 4 types of diarrhea?
So when I was in clinic with Dr. Lou, we would run into this quite often. We actually had patients that had all types of diarrhea. We had patients that would be taking a pancreatic enzyme like Creon, patients that would be taking a bile acid salt that they would put in their drink, as well as patients that would be taking Zermello. So yes, it is absolutely happens. Make sure you speak to your physician about it.
I love spaghetti sauce. Is this okay? I know we're supposed to avoid tomato.
I always suggest staying away from the tomato. And the reason I say that is because a lot of tomato sauces are made with the seeds from the tomato. And what I learned about a tomato are the seeds are in a tomato to help it reproduce, right? So when something eats the tomato, it kind of causes inflammation in people and indigestion because the tomato's like, hey, don't eat me. I need you. I need to be in the ground. I need to grow and I need to reproduce. So I always suggest staying away from some of those tomatoes. And myself as well, like when I eat tomatoes, I make sure that I make my own sauces and I do take off the skin on the tomato as well as the seeds because of the inflammation. I also don't eat tomato sauce late in the evenings as it causes indigestion or reflux for myself. So remember, a tomato wants to reproduce. So when you eat it, those little seeds can cause havoc on your insides.
Yeah, I always make it with tomato puree because I always find that helps a little bit. And you know, remember you have to stay away from these. You should stay away from a lot of the foods, but remember, don't deprive yourself either. Once in a while, if you really want something, I have found through the 22 years that if I want something, I know I'm going to pay for it. And so, you know, you cheat a little bit and then you pay for it and then you go back onto the diet. But don't deprive yourself too much because that's not good either.
That's a great suggestion, Marianne.
Yep.
Thank you.
Yep, for sure. For NET patients whose local oncologists have referred them to a local dietitian, is it possible for your nurse supports program folks to consult with the local dietitian?
Absolutely. So, guys, we spend 50% of our time in the field in clinics. In fact, we did a presentation a couple weeks ago for a group of dietitians at the Mayo Clinic in Rochester. So I would absolutely love if you would help us gain that relationship with these different dietitians so we can provide them the nutrition book. We can also consult together and talk through some different ideas. So yes, we would love you to put us in touch with dietitians.
One other thing I want to, oh, sorry, Mike.
No, go ahead.
One other thing that I want to mention is just to remind everybody, this nurse program is open to anybody. You do not need to be on Zermello. They are out there helping NET patients, whether you have carcinoid syndrome or not. If you need some help with dietitian or nutrition or anything like that, these nurses are there to help you. So take advantage of the opportunity to get the information and to work with them to get your health back on track.
And I wanted to mention, Marianne, myself as well as my entire team, we're going to be at the NCAN National in Atlanta. So come see us in person. We will be there the entire time. We're so excited. So absolutely make sure you reach out to us if you all are there.
Absolutely. It's going to be a good time. I got another question here. What about turkey? It doesn't bother me, but I read it increases serotonin.
Yeah, and I am actually going to turn this one over to Marianne, but that tryptophan is a real thing within the turkey.
Yeah, it's funny now when I think about it. Back then it wasn't so funny, but every Thanksgiving I would have really severe stomach pains and I kept on going to the hospital, and they kept on telling me I passed kidney stones, but I only passed them on Thanksgiving. And it wasn't until much later on that I found out that it was actually the turkey that was causing the carcinoid syndrome. And the funny part about it is, when Dr. Warner and when Monica Warner was still alive, we were very close with Dr. Warner and Monica Warner. And they called us up Thanksgiving morning and said, happy Thanksgiving. Are you looking forward to dinner? And I said, no. I said, it's a nightmare. And Dr. Warner said to me, why? And I said, I don't know. Every Thanksgiving I pass kidney stones. I said, so I hate it. So then we were talking and everything else, and then we realized that it was actually the turkey, and then I am super duper sensitive to the tryptophan in the turkey. And so it sets me off. So in order to have Thanksgiving dinner, many years I would have to make a turkey for the rest of the family, and then I would make a little ham or something for myself. But then we learned that I can give myself a rescue shot of octreotide beforehand, be able to eat my turkey, and then have 6 hours or 8 hours later have another shot, and that would get me through. So I do eat turkey on Thanksgiving now, but I just give myself the injections beforehand because I know. So a lot of people can eat turkey and not have a problem. And then there's people like me where it goes into a full-blown carcinoid crisis. So, just there's some days where you might eat something and you might not have a problem, and then the next time you eat it, there may be a problem. So it's always, if you have an issue the first time, try it a second time. If it happens the second time, then it's definitely, your body's always changing. So just it's trial and error.
Right. And I do want to mention, why does turkey do that? So tryptophan hydroxylase, tryptophan, which is in turkey, actually is a precursor to serotonin. So once it gets into your digestive tract, that tryptophan turns into serotonin. So if you already have a neuroendocrine tumor that's secreting that excess serotonin, and then we add that turkey, which turns into serotonin through the tryptophan, you're going to have quite a bit of serotonin. So that's what's happening in the body.
All right, I got another question here. This is a fun one. Because I like chili. So what about beans?
Yeah.
What beans would be best to use in a chili recipe?
Yeah, that's a really, I really think it's a personal preference. I think, especially with our NET patients, you guys, it's trial and error. What works for you, what does not work for you. I know I can personally say, and I don't have a neuroendocrine tumor, but I like black beans myself. Some patients are not able to have beans at all. I have some patients that can have beans, but they use Beano or Gas X because of the bloating that they get. So it really is trial and error. Marianne, any thoughts around chili?
Yeah, like I said, everything is trial and error. If you want that chili, then make sure that you're eating it at home, so you're close to a bathroom, and that you're going to pay for it. I mean, there are just certain things that once in a while isn't a bad thing to eat. It's not going to really do any permanent damage to you, but you may be spending time in the bathroom.
Yeah, also it is tomato based as well.
Exactly.
Yes.
Right.
So
like I said, if you use the tomato puree, most of the time it's not as bad. And like Pam said, eat it during the day, earlier in the day. Anything like after 6 o'clock, make sure that you're walking around and stuff, because then when you're laying down, the acid does come back. And then you end up with the hiatal hernia and all kinds of other issues that come with that. So usually try to do it earlier in the day.
This question has come across quite a bit, so it leads me to believe that Atlanta will be a really fun time. Alcoholic beverages, yes or no?
Trial and error, but I would always, what I find is my NET patients start to flush. They'll get some stomach and GI issues. trial and error. So I have other patients, and Marianne, I'm going to let you speak to this, that have no effect from alcohol. So
Yeah.
it really is the patient.
It is, you know, a patient. Is it something that we recommend every day? Absolutely not. It's not good for anybody to be drinking every day. But if it's a special occasion or something like that, and you want to celebrate, you know, if you're not having any issues with it, that's fine. I was taught back in 2003 by Dr. Odovicio that Robert and I had a conference in Long Island. We brought him out to a restaurant afterwards. Everybody at the table had a glass of wine. Dr. Odovicio turned to me and said to me, "Aren't you going to have a glass of wine?" And I said, "No, because I flush." And he looked at me. He said, "Do you have an octreotide sub-Q shot with you?" And I said, "Yes." He said, "Go in the bathroom and give yourself one." He said, "Why are you depriving yourself?" And so I went to the bathroom, and 15 minutes later, I was able to have a drink. Now, is this something I do all the time? Absolutely not. But when Michael got married and Trisha got married, and if we have a special occasion or something like that that we're celebrating, I will give myself an injection beforehand. Now, I can drink beer. I have absolutely no issues, no flushing, no diarrhea. I can't drink wine or alcohol, like vodka or bourbon or anything like that. Automatically full flush, full diarrhea, abdominal pains really bad. If you have a lot of tumors in your liver, it's not the greatest thing to do. But like I said, if you do it in moderation, once in a while on a special occasion, you know, check with your doctors, but you know, it should be okay.
I got another one here. Does tumor load impact food? So if your tumor load is lessened, you can potentially eat more amine food, etc.
You know, and I'm going to say basically it's up to the patient. I mean, we had patients that would have a small tumor load, but those tumors would secrete quite a bit of serotonin. And then you have other patients that have a larger tumor load with less serotonin. So it really is based on the patient. And really, it's true when they say neuroendocrine patients are zebras, because everybody's different. The tumor load, how much serotonin they secrete, and other hormones. So it's really trial and error. And I'll pass that over to Marianne to add to that.
Yeah, I mean, each one of us is so individual. You know, a tumor that is like 3 millimeters can cause as much havoc to your body as someone that has a 10 centimeter tumor. You know, sometimes the little, as Dr. Warner explained to me when I was first diagnosed, sometimes the little tumors are smaller than a grain of rice or salt. But if you put them in a sifter, they come out to a bigger tumor. But you might have severe syndrome where somebody who has a tumor that's 10 centimeters in their liver might not show any whatsoever carcinoid syndrome. So we're all individual. You know, everything is trial and error. And the best thing that you could do is keep a diary. Keep a diary of what you're eating, what, you know, especially if you're having problems. If you're not having problems, you don't need to keep a diary. But if you're having a problem, usually I say a good amount is to try to take a diary like 7 to 10 days before your doctor's appointment. And I will tell you, I am just as guilty as anybody else. When you get into that doctor's office and you're talking to them and they say to you, "How are you feeling?" Fine. "How's your diarrhea?" Fine. "How's your whatever?" But if you have that diary, you'll remember. You kind of don't want to, it's kind of like a white coat syndrome, I think, or you want to please the doctor, you want to burden the doctor because you only have that 15 minutes or so. But I'm just as guilty as anybody. And I'll say, "Oh, fine." And Robert will come into the room with me and he'll say, "You're not fine. You were in the bathroom 10 times yesterday. What the heck are you talking about?" And I'll be like, "Yeah, but that's not so bad." And he's like, "No, that's not normal, Marianne. That's not normal, you know?" So it's always good to have like a diary because, like I said, that doctor walks in the room, you know, you have 10 minutes with that doctor, and you don't want to be talking about being in the bathroom 10 times. You want to talk about, how's your blood work, what your serotonin level is, what this is, or what's that, what's the next test you're going to do, what's the next treatment. You don't want to talk about the fact that you've been in the bathroom 10 times.
Yeah.
So keeping a
Great.
diary, not for the 30 days, but maybe 7 days ahead of time, even 3 days ahead of time. I think that, especially when you're on your shots, when you're getting your Sandostatin shot, your lanreotide shots, you really should keep it the last week, because that's when most people see that the medication is wearing off, and that's when your symptoms are coming out more. So that's the best time to do it.
Yeah, that's great. That's great advice, Marianne. In addition to that diary too, I also suggest, and Marianne kind of mentioned, jot down questions that you have for the physician, because sometimes it seems like you get in there and you feel so rushed, you forget to ask. So when I was in clinic, there were so many times that a patient would leave Dr. Lou's office and the next day call me and say, I forgot to ask all 5 of these questions. So I think it's really important to feel prepared when you go in, because they have such a limited amount of time. So that's great advice. Thank you, Marianne.
Thanks.
Is there a way to avoid losing weight when you cut back on the fatty foods?
I mean, absolutely. Like I said, what I always suggest is let's choose foods that are higher in proteins, and you're going to eat several times a day, right? You don't have to eat fatty foods necessarily to gain weight, but you can eat several times a day, several different meals. Increase your proteins, eat some vegetables, even some different grains are okay, and start to count your calories. Make sure that if you're speaking to a dietitian, that you should be getting the number of calories they are suggesting for you. We all need a specific amount of calories per day. None of us should be getting those from fatty foods. Let's be honest. Let's make healthier choices, right? Even though sometimes those fried foods taste better, but really trying to look at foods that are high in protein, that have some sort of nutrients. And when I was in clinic, Dr. Lou used to always tell people, eat those vegetables that are dark in color, eat those purple carrots and those, green leafy vegetables and things like that. So those are healthier choices to make.
Can we eat avocados? I know they're fatty.
Yeah, they're a good fat. The thing though with avocados is they do have a higher content of serotonin in them. So again, that's a trial and error. It depends with the patient. If you can eat it and it doesn't affect your GI tract, I would suggest eating some avocado because it's healthy in terms of its fat. But there's some people, because of the serotonin, that it moves through rather quickly and they prefer not to eat avocados. Marianne, do you eat avocados? Curious. No. Yeah.
But there's all the list for the 5-HIAA of certain things that you're supposed to stay away from. A lot of people don't understand that that's really during the testing period. If you eat it otherwise, like 3 days before, they don't want you to eat it 3 days before. But otherwise, you can eat it, anything, if it doesn't bother you. If it's not causing syndrome, it's not raising your serotonin, you can eat it. I mean, people do it all the time. I remember when I first got diagnosed, pineapple is on that list. Well, my kids will tell you that I eat a lot of pineapple. A lot of pineapple, to the point where I get blisters in my mouth because I eat so much pineapple. And it was really funny. I was due for my 5-HIAA, and we were at a conference in New York with Dr. Warner and Monica Warner there, and Monica had this beautiful fruit display with pineapple and cantaloupe and everything else. And I'm saying, oh yeah, so tomorrow I start my 5-HIAA and everything else. And she goes, oh, that's good. I think it was like I might have only been diagnosed like 6 months or so, 8 months. So I'm standing there and I'm talking to her, helping set up, and I'm piling on all this pineapple on the plate and I'm shoving it in my mouth. Never said a word to me. Then all of a sudden the talk goes on and they're like, oh, and stay away from pineapple. And I'm like, why didn't anybody say anything to me? I'm eating like a whole entire pineapple. So we had to cancel the test and do it again the following week. So, but the pineapple itself doesn't bother me, but because of the 5-HIA, you are supposed to avoid it. But, like I said, turkey, a lot of people eat turkey. It doesn't bother them. It bothers me, but I can eat a whole pineapple and not have any problems. But I've learned now not to do that when I'm doing my 5-HIA.
We're just going to do one last call for any questions to be texted in. We've got a few left. So can you tell if it's the therapy or the disease affecting your nutrition?
Good question. Therapy, I think it, like Marianne said, I really believe that if you keep a diary, then we could individually look into it for you. I think both. I mean, I've seen people that it's their disease, and I've seen other people it's definitely the way they are eating. I think if we could really focus on a diary and figure out if it is nutritional, make those changes, because we do work with patients every day where we will look at some triggers, we'll make some changes, and life changes for them.
Yeah, definitely.
All right. That's all the questions we've got. So, Pam?
Well, Pam, anything else you want to add?
No, I just thank you, NCAN. I absolutely love coming on and talking. I'm so excited to see you all in person. I hope everybody comes to the conference. Really, really looking forward to it. I'm always available, Marianne. Reach out to Marianne if you have any specific questions or wanted to get a hold of me. You can always enroll in the nurse support program with Tercera. I'm always available there as well.
Okay, Pam, could you just give us
mention this one.
Right. Can you give us the link for the book and also the link for the nurses? Do you have that?
I do. So it's can I type it in? It's fine. Yeah, there it is.
Okay.
There is the book,
Okay.
foodlovebook.com.
Okay.
And then to enroll in the nurse support program, it's enrollzermello.com.
Okay. All right. And if anybody has any questions, they're more than welcome to call me and, at the 866-850-9555 number, and I will get you in touch with Pam. So we are going to, in the comments, you can see there is a link. We are going to transfer over to Zoom to do the support group meeting. If anybody would like to join us, thank you again for getting up this morning and giving up your time. And we'll see you all soon. So click on the link. See you later. Bye.
Bye.